Welcome back to Loosening Up, the KA-EMDR Podcast. I'm Danielle Ciccone, and today I'm going to be joined by my guest, Cheryl Moore, who I'm really looking forward to talking to. Cheryl has taken our trainings and participated in our live experiential training and consultation, so I really got a chance to actually see her in action and talk with her about how things are going in her practice. But I'm excited to have her on the podcast so she could share more about her experience. She seems to be pretty enthusiastic about implementing this. So I hope you enjoyed this conversation. Hello, Cheryl. Good to see you.
Hi, Danielle. It's good to see you too.
Thank you so much for joining me today.
Yeah, thank you for the invitation.
And as I said to you before we started recording, Michelle wishes she could be here. She's just traveling today, so she's looking forward to listening to this, but sad I hope that she's not here.
It is, and I hope she's having so much fun on her trip.
Yeah, me too. Okay, do you want to share a little bit about yourself? Just kind of introduce yourself, your practice, anything you'd like our listeners to know.
Okay, sure. My name is Cheryl Moore, and I own and operate More Life Counseling because there's more to life. And that's really the theme of my practice. My practice in West Des Moines, Iowa. I'm a licensed mental health counselor, and I'm really focused on working with adults, and especially those who have experienced all different kinds of trauma, maybe experiencing anxiety, depression, that of course goes along with that too. It could be that they had a crappy childhood. It could be that they're recovering from a really difficult relationship. It could be all sorts of different things. And I work with those individuals, adults age 18 plus, and we work kind of in a fashion where I think about us being kind of a comprehensive program where we're working with some individuals to really build skills before they're able to do deep things like EMDR reprocessing. So we use some DBT therapy in order to do that. I do use some group therapies. So group therapies that also involve ketamine. So ketamine assisted psychotherapy groups and processing groups and all sorts of things because we are healed in groups as well. Some attachment focus, some IFS interventions in there, and just a lot of experientials. So my clients would say that they are not surprised whenever they're sitting there and I ask them, do you want to try something different?
Right. Yeah.
So lots of creativity and different interventions that we use within the therapy too. I'm EMDR certified and just started working on the consultant in training certification. So I'm excited about that. And I'm also certified with accelerated resolution therapy and ketamine assisted psychotherapy. And I'm really excited about using the ketamine assisted EMDR in my practice.
Yeah. Okay. Well, you've got a whole bunch of awesome experience and tools in your toolbox. Tell us a little bit about why specifically ketamine assisted EMDR, like kind of how you came into that or becoming interested in that specifically.
Yeah. So I think it was last summer when I had a friend that's a psychiatric mental health nurse practitioner actually approached me and she's like, I've been learning more and more about ketamine and ketamine assisted psychotherapy. And she started talking to me about it a little bit. I started doing a little bit of research and with my trauma focus and the folks that I work with, I'm like, oh my land, yes, I need to get trained. I need to implement this into my practice. And there's a trainer that's local. Amber Kirby is her name that does the ketamine assisted psychotherapy training here. And I signed up. I'm like, okay, let's do this. It was offered like at a time that I could do it. And I'm like, I'm just going to plug in and do it. Anyway, as I started working through that training and learning more about ketamine and the effects and the implications and the healing that can take place with ketamine and ketamine-assisted psychotherapy, my EMDR brain is saying, why aren't we doing this with EMDR? And this has got to be done with EMDR. And is anyone doing this with EMDR? And nobody knew. So anytime I would ask, everybody's like, oh, that's a great idea. Nobody really knew. So I simply did a Google search for ketamine assisted EMDR trainings. And your training came up, and with the ketamine assisted psychotherapy or the ketamine assisted EMDR Institute. And
Mm-hmm.
I looked it up and I saw that it was EMDRIA approved. And I'm like, that's the one that I want.
Mm-hmm.
And so I signed up. I
Nice.
completed my ketamine assisted psychotherapy training in
Uh-huh.
October of last year. And I completed the on-demand training for ketamine assisted EMDR in October of last year. So
Mm-hmm.
I did both kind of at the same time.
Yeah,
And it was really exciting for me.
that's so cool. I'm so glad you found us. I really
Yeah,
am.
me
And
too.
and I think I've said this even on this podcast. That is such a common thing we hear. That if
Mm,
someone's already an EMDR therapist and then they learn a little bit about ketamine and CAP, they're going, this has to go together, right?
yeah,
But like
yeah,
how exactly, right?
yeah,
And so I think it's just such a natural combination. It just makes sense to a lot of people.
yeah.
Um, okay, cool. So have you done much of the higher dose CAP work, or have like since you kind of finished those trainings, what
Mhm.
has been more the focus? That sort of the more traditional CAP, or have you mostly been focusing on this lower dose use of the
Mhm.
medicine with the EMDR?
Mhm.
What's kind of been your focus, or has it been sort of a combination of the two?
Yeah, it's kind of been a combination of the two.
Okay.
So, I mean, I work with some folks that really want more of the CAP modality.
Mm-hmm.
What I have noticed is when I'm working with CAP, that it's not unusual to do a session or two of CAP
Mm-hmm.
and then to say, I think some of the things that are coming up in your CAP sessions,
Mm-hmm.
we could really go in a little deeper and reprocess in a different way with
Right.
using those lower doses and integrating the EMDR for the ketamine assisted EMDR.
Right.
And most people are like, okay, let's do it.
Mm-hmm. Yeah, that makes sense. Because
Yeah.
Michelle and I always talk about it as just a more targeted way of working with the
Yeah.
medicine, right? Versus
Yeah.
with traditional CAP, which is often a little more kind of open ended,
Hmm.
exploratory, see what happens. You know, the framework and the structure of EMDR really gives you kind of a targeted way of addressing these things. So that makes a lot of sense.
Yeah.
Hmm.
Absolutely. Yeah.
Yeah, good.
So my practice is definitely I let people know, we're gonna create your treatment plan based off of what your needs are. So
Yep.
let's talk about what is your goal?
Hmm.
Where do you want to go? And kind of, anything that we do in any work with ketamine, we want to have an intention
Hmm.
more than an expectation, or we're likely to be
Absolutely.
let down. So
Yeah.
what is the intention? What are we really trying to do? And a lot of the themes that I see with clients that come to me have a lot to do with, yes, there's reprocessing trauma, but it goes deeper than that.
Hmm.
It goes deeper into who am I anyway? It goes into themes of identity and
Hmm.
themes of, okay, so I've been told all my life that I'm this or I'm that, and I felt
Hmm.
like I'm not good enough, or I felt like I'm not lovable, and I bought into some of these
Mm.
things. But now I'm beginning to start to want to challenge those things. But boy, it's hard
Oh,
when
yeah.
these things start to open up a little bit. It's hard to get in there and to
Mhm.
digest it. And I've found that, and my clients have found too, that adding that low dose of ketamine really
Mhm.
helps with the digestion process.
Absolutely. Yep. Yeah, I mean, my favorite way to do this, and we talk about this in the training, is to just, do some good old-fashioned kind of standard EMDR.
Mhm.
Do all that history taking and case conceptualization and preparation and do some standard EMDR, kind of
Mhm.
get used to that
Mhm.
process, and then add the low dose of ketamine and see where it can take us from there, right? Because we have sort of
Yes.
a baseline of where's the person getting a little stuck or kind of having some challenges when they're trying to sort of process this hard material, without the assistance of the ketamine,
Right.
kind of evaluate that, assess that, and then add the low dose of ketamine and really
Yeah.
be able to see pretty clearly, usually in my experience, how much deeper they can go, how much
Yeah.
more flexible, how much more open,
Yeah.
how much that adaptive information processing happens, more readily and more easily. So
Yeah.
I really like to see, kind of the comparison
Yeah.
of, I mean, because standard EMDR is fantastic, right? I
Absolutely.
love the model.
Yes.
Um,
Yes.
but then being able to see what the addition of the low dose of ketamine can
Yeah.
add, you
Yeah.
know?
Yep. I
Yeah.
agree. Yes.
And have you found what's it been like for you to sort of even approach clients about this, or like broach the possibility of working
Mhm.
this way? What's sort of
Mhm.
been the attitudes, I guess, from your clientele or your community, or what's that been like?
Yeah. Yeah. From my clientele, usually just like you said, I'm working with clients and I'm not just when they walk in the door, I'm not saying, "Hey, let's add ketamine." When they walk in the door, we're doing that really good history taking. We're getting to know one another. We develop rapport.
Mm-hmm.
And then we may do some bilateral stimulation, some like EMD or
Mm-hmm.
D little r.
Yeah.
Or even some of the more EMDR processing too. But we're really looking to assess how's that working for you. And if they're really getting stuck and it's really difficult, then one of the ways that I approach this with clients is essentially to give a metaphor
Mm-hmm.
that if I have a cavity in
Mm-hmm.
my tooth and I need to go to the dentist and I need to get that cavity filled, then when I go in to the dentist, they are going to give me Novocaine. It's a pain medicine. They're going to give me Novocaine before they start drilling into that tooth in
Right.
order to dig out the decay so that they can
Yeah.
fill it with the good stuff.
Yeah.
So as
Hmm.
they're doing that, that Novocaine sitting in that dentist chair, I mean, I've got the numbing agent, the pain medicine, but that doesn't mean that that it's wonderful and beautiful and I'm in la la land. I'm
Right.
still feeling the pressure. I'm
Yeah.
still hearing the drill. I might still have my hands clenched and be like, oh my goodness, this is hard. It's
Yeah.
not that it takes the pain away, but it makes it tolerable.
Right.
It
Yeah.
makes it so that I'm not jumping out of that chair and running out of that room so that we
Yeah.
can get that tooth, the decay out of it, and we can get it filled with the good stuff, which is what we could say in the EMDR language that's that adaptive information and
Mm-hmm.
the positive cognition that we're really looking to instill. Could be like the
Mm-hmm.
filling in that cavity.
Mm-hmm. I love that. I totally love that metaphor.
Yeah.
Um, and the way I see it now, it's like, in fact, I just had a session a couple days ago, and it wasn't bad. This was a standard EMDR session because it's a relatively new client. It was not bad. There was nothing wrong, even necessarily. But the whole time I'm sitting there going, gosh, this could go so much better. I can see how this could be enhanced, and we can move this thing that we were working on more quickly and more easily with the low dose of ketamine.
Yeah.
And in fact, that probably will be part of the treatment plan. But
Yeah.
it's hard now in some ways to
Yeah.
kind of not use it now that I've seen
Yeah.
what it can do for people and how it can just sort of make the whole process a little easier, a little less painful,
Yeah.
a little
Yeah.
smoother.
Yeah.
I don't know if you've had that experience, but you know,
I sure
now
have.
doing
Yep.
EMDR without it, it's still great, but it's just a little more
Yes.
challenging now that you see what's possible with the
Yeah.
addition of the medicine.
Absolutely. Yes.
And I think even my clients most of the time feel that way. Pretty much everybody I've done this with has said, "Okay, I see what you
Yeah.
mean.
Yeah.
This makes the process more tolerable and more effective."
I
So,
agree. That's been my experience too. And
yeah.
even as you were talking, I'm like, oh yeah, with my clients that I've done like regular cap work with, and then said, let's try some ketamine assisted EMDR. Then when we do the ketamine assisted EMDR, frequently what I hear is, oh, I like that better.
I've had
Let's
the
do that
same.
instead. Yeah.
Yep. I've had the same experience, and I was really actually surprised when I started to hear that. Um, few years ago when I was still doing quite a bit of the higher dose cap work, and I was just kind of
Hmm.
playing around with the low dose with EMDR. Like, okay, let's try this out. Let's see what happens. But in my mind, I'm thinking, well, it's such a low dose. Maybe it's really not going to do much. But I kept hearing the same thing. You know,
Hmm.
despite it being
Hmm.
a much lower dose,
Yeah.
people would say, I'm getting so much more out of this. And that's when I
Yeah.
was like, okay, there's something to this. And I really
Yeah.
started to take it a lot more seriously.
Yeah.
People who
Absolutely.
had done 6, 8, sometimes more
Yeah.
cap sessions, with
Yeah.
just the higher dose of ketamine, no EMDR. Same. I've heard the
Yeah.
same thing.
Yeah. Another thing I've noticed, like as a clinician, is if I have a client who maybe has a pervasively nervous system, And so they may be wanting cap in order to kind of help soothe their nervous system. The
Mm-hmm.
higher doses sometimes they don't soothe. They feel like, oh, I'm losing control.
Exactly.
And then it kind of has the reverse effect where they become
Yes.
more nervous. But with the lower doses of ketamine, then I'm able to co-regulate more easily
Mm-hmm.
with them and keep them in the room and help with the grounding and all of the really great stuff that really works for the neuroplasticity in order to have that disconfirming experience
Mm-hmm.
of what it's like to relax and be with someone
And be safe and be
and be
okay.
safe.
And,
Yeah,
um,
yeah,
oh, I hear what you're saying so much about
yeah,
how it can actually sort of backfire, I guess is the way I think about it with
yeah,
certain people, when they, when they take a higher dose. And,
yeah.
I was taught in the beginning that there's, usually a little blip of anxiety in the beginning, as the medicine's coming on. But I had some
Sure.
people that really were like anxious the whole way through and really couldn't
Mhm. Mhm.
settle.
Mhm.
And, I always say, especially with people with more complex trauma who, you
Yep.
know, like have been through a lot of hard stuff, it is not easy to just let go and,
No,
trust what's going to
actually,
happen.
yeah, and actually letting go can feel very unsafe
Right.
and very dangerous for someone that has that complex trauma. So that
Yeah.
has been my experience that when we're working with complex trauma, these lower doses are so much more friendly to their nervous
Yes.
system and
Yeah.
really help them to progress in the way that they want to.
Hmm. Yep.
Yeah.
I've seen the same, so,
Yeah.
it's not that I'm opposed to the higher doses and the traditional cap work. I know
Oh,
there's
no.
so much research that shows that it's,
Oh, yeah.
incredibly powerful for so many people. But I think,
Mhm.
especially as a trauma therapist,
Mhm.
working mostly with complex trauma, this is, the lower dose ketamine assisted EMDR has been, like you said, more friendly, more
Mhm.
approachable, and I think
Yeah.
actually more effective because it's better tolerated and
Yeah.
it's not so daunting. And,
Yeah.
so,
Yeah.
um, okay. So do you want to share a little bit about your own experience? Would you feel comfortable sharing anything you
Sure.
want to
Yeah.
about the experiential training? Because I know for most of the people we talk to, that's where they really kind of get inspired and excited is, through their own experience. So I don't know
Right.
if you want to share a little bit about that.
Right. So my first experience with ketamine at all was in my
Hmm.
CAP training where we had an experiential so that you could experience the medicine. And I am a firm believer that if I'm going to do any kind of therapy, that it needs to be something that I've experienced myself so that
Yeah.
I've experienced it. You
Yeah.
can't really lead where you haven't been before. So,
Yeah.
that was interesting when I had that experience in my CAP training. And so that was different. I had a great experience there, but the experience with the experiential, I was, I went into it. First of all, it was online. And most
Hmm.
of my work is primarily in person, and
Okay.
online work is not my favorite work to
Yeah.
do. I prefer in person. So there was a part of
Yeah.
me that was like, how is this going to work with
Hmm.
being virtual? And
Hmm.
I was pleasantly surprised, very
Hmm.
pleasantly surprised that it works beautifully.
Yeah.
Um, I decided our experiential training to work on something that I really had never worked on before, with any kind of EMDR. I talked about it with my therapist a little bit, but really thought, I think I'm okay with this. It's not something that I usually get triggered by, but let's just see what comes up when we add some ketamine to it. And the issue that I worked on was a memory or a history of being in a coercive system of control where
Mm-hmm.
there was some sexual exploitation. And it was a difficult time in my life, to say the least. But I thought, I'm okay. Not going to be a big deal.
Yeah.
And I was okay. As we went into the experiential, then, and I start to feel some of the feelings and remembering some of the things, then some more memories came up for me. And it was just so cool how with the medicine and the support of my cohort person,
Yeah, your partner.
that my partner, yeah, that's the word, that we were able to work through that in a way that really did clear any kind of residual effects that I had from that. And some of that stuff that I didn't even realize how it was affecting me and impacting me today in
Yep.
things like holding me back from really being able to pursue some of my dreams for fear that I was doing something wrong or that I was going to, that I was doing something wrong or being bad or that I was going to get into trouble. So being able to really, go through that with the ketamine assisted EMDR, seeing the situation from a little different light, having more insight with that, gaining insight from my inner wisdom and also through my faith to essentially say, one of the things that came up for me in it was within this system that there was like this whole table of people that were around me that were wanting me to justify my actions and that were telling me all the things that I'd done wrong. And it wasn't a fun deal.
Yeah.
But with the ketamine assisted EMDR, I saw them for who they were. Well, in my mind, there were these people that were sitting around with the medicine that I saw like they had dog faces. I saw them as dogs that were panting, like wanting me to tell me more. I was entertaining.
Yeah.
And I saw that this was for their entertainment. And I stood up from that table and I flipped the table up and I said, I am not here for your entertainment. And I told them to get out and to leave me alone, that I had work to do and the work that I had to do was important and that I was not going to be held back by it anymore.
Wow.
And I have felt freedom from that in a way that I hadn't experienced before ever since that experiential. It
That
was
is
profound.
awesome.
Yeah,
Oh, yeah.
it was truly profound.
Sounds like it.
Yeah.
Yeah, what strikes me is just the I want to say the vividness or just kind of like the gosh, I'm having a hard time finding the right word. Vividness, intensity. I guess you're saying it. Profound, right? Like
Yeah.
powerful. Powerful, I guess, is really
Yeah.
the word that I'm looking for. It's more than just I'm thinking about it and I'm, trying to talk myself through it or something, right? Like the kind of the powerful, the imagery, it's just so
Yes,
vivid, but not in a painfully vivid way, if
not in
that
a
makes
painfully
sense.
vivid way, more in a, oh, somebody turned the lights on kind of a way. Yet
Yeah.
now I can see things for what they truly were in a totally
Yes.
different way.
Yeah.
And without the medicine, I would think that I would have probably, knowing myself, knowing my history, knowing how I've been in other processing sessions, there would have probably been more of a, well, yeah, but. And well, I'm sure that they had good intentions or this was the reason or any of those kind of excuses or sticky places that would have come
Yeah.
in. But with the ketamine on board, it was more, again, kind of like they turned the lights on and I
Yeah,
could
it's a good way
see
to put it.
things for what they were. And then I could say, oh no, no, we're not latching on to any of that sticky stuff. We're going to turn this table over and you get out of here because I got work to do.
I love that. I love that. Some of these stories, it is kind of funny, right? Some of the creative and interesting things that our brains will do during ketamine assisted EMDR. Not always, but for many people, there's some often kind of funny, kind of silly, like certainly interesting images or metaphors or things like that, symbols. So I love to hear, how things transform for people. But it sounds like it was potent, right? There was a potent disconfirming experience that happened.
Absolutely.
Of what, like, I think what I'm hearing is like empowerment and,
Yes.
self-advocacy or,
That's
I don't know
right.
exactly how you would describe it,
Yep.
but very
That's
potent.
exactly right. Yes. And that's what I've seen in my clients too. That's one of the beautiful things about this modality. We go in, we may have a target that we're working on. There could be a target memory and there's the negative cognition that might be I'm not good enough or whatever it may be, but it's more than just reprocessing that
Mm-hmm.
target. It is moving into the positive cognition that might be, I am good enough, but
Mm-hmm.
it's not just I am good enough. It's like this
Mm-hmm.
felt sense of
Exactly.
I am good enough. So
Yep.
it's not just, oh, I'm good enough. It's
Yep.
I am good enough.
I know exactly what you mean, which in the way I think about that is it's more than a cognitive exercise, right? It's more than just a
Yes.
cognitive restructuring. There is
Yeah.
a truly like felt sense of something deeply moving and shifting and
Yeah.
transforming that, yes, we put words to it and we put it
Yeah.
in the form of a cognition, but it is so much more than a cognitive exercise.
So much more. It's
That
experiential.
very, and that, for
Yes.
me personally, I love EMDR and I would do great EMDR with my therapist, previously. Um, but now that I have the experience of doing ketamine assisted EMDR, I realize how cognitive I really was
Yeah.
previously and how
Yeah.
much more embodied and,
Yes.
how much things are shifting and changing on a much deeper level now,
Yes.
than they ever did before without the
Yeah.
medicine. So,
Yeah.
I just, I think a lot of people will find that this can take them much deeper. And I even
Yeah.
think that even the people that don't really struggle with the EMDR, but, they do fine with EMDR, but they're still surprised at
Mhm.
how much more is possible
Yeah.
with
I
the
agree.
addition of the low dose of ketamine.
Yep.
So I don't necessarily only see it as something to use for people that are stuck. It certainly can be
Oh,
helpful in those
no.
cases. But I
Mhm.
think there's many people that they just want to see what more is there? What more can I actually do here?
Right. Yeah. I'm with you there, Danielle. It's not just because I'm stuck,
Yeah.
but it can really be because I want to go a little deeper.
Yeah.
I
Yep.
know that there might be more that
Hmm.
I can get to there.
Yeah.
Yeah. So it's not just about being stuck. It's about wanting more.
Yep. Yep.
Yeah.
And it can be both. So that's what I'm seeing. I don't know if you're starting to get people that are asking for it yet. Are you getting any referrals or inquiries specifically about ketamine assisted EMDR quite yet?
I am,
Okay.
and it's a little slow maybe because there aren't very many of us in the area that
Yeah.
are aware or doing this modality. I've been
Yeah.
spreading the word, so there's
Yeah.
a few people that have gone through the training and are getting ready to kind of start implementing this more in their practice too. But right
Yeah.
now, it's pretty much me, and
Okay.
my caseload is pretty full.
Yeah.
Um, so it's been hard to have space to add a whole lot more in.
Yeah.
But I am getting the referrals.
Yeah.
Yeah.
And
Yeah.
I'm sure that will increase because it's,
I'm
for that's primarily what people are seeking me out for
yeah.
now. And it's
Yep.
interesting to hear people's rationale or their, why they're seeking this out, right? And
Mhm.
for the most part, what I'm seeing is kind of a combination. Some people saying, I've tried EMDR and
Mhm.
people say it can be so helpful, but man, it was really hard for me and I don't know if I got much out of it. So I definitely get
Yeah.
those types of inquiries. And then I also get people that are just like, this sounds like a really deep exploration and I'm game for that. And I want to do
Yeah.
some deep work and
Yeah.
I'm just really curious and open and,
Yeah.
want to see what,
Yeah.
what we can do.
Right.
So yeah, more and more, I think people are getting really curious about this and
I think so.
interested in what it can offer them. So
I think it's gonna just continue to grow too. Yeah.
yeah. Yeah, definitely. Definitely. And, I'm really glad you are building a little bit of a community,
Yeah.
of people in your area because,
Yeah.
where I'm at in California, it's happening. Well, ketamine assisted EMDR specifically is still, a relatively small group of people, but
Mhm.
ketamine assisted therapy in general is, fairly common here. But I'm
Mhm.
curious where you are,
Mhm.
if there's been kind of a slower,
Y
I guess,
yes.
interest in the broader community about using a medicine like ketamine in therapy.
Absolutely. Yeah,
Yeah.
absolutely. I think, I don't know exactly how long I couldn't tell you exactly how long that
Mhm.
ketamine assisted therapy has been in our area, but I know
Mhm.
that it's been very, very contained
Yeah,
and
I would
not very
imagine.
many people that have the training or
Mhm.
have been implementing that at all. So, to my knowledge, it's just in the past very few years
Mhm.
that more people have been being trained for ketamine assisted psychotherapy and have actually
Mhm.
started implementing that modality. Now, of
Yeah.
course, there are ketamine clinics and more of the
Right.
medical model around, but actually
Yeah.
doing it with the therapy
Mhm.
it has not been around nearly as long. So,
Yeah.
yeah. So
But
now
it's
it's spreading
happening.
the
So
word. It
yeah,
is. Yes.
that's
Yes.
really exciting. It's really exciting.
Yes.
Yeah, I should have counted. I can't remember how many states we have people trained in now, but it's quite a few, like we're really getting, I mean, of
Yeah.
course you've got your pockets of, Colorado, Oregon, California, you got quite a lot of people, but um it makes me really happy
Yeah.
when we get students coming from different parts of the
Yeah.
country where I know there's not much of this going on, and it's
No.
exciting to hear it kind of becoming an option for more
Mhm.
people, you know?
Colorado, Oregon, and California are a long ways from Iowa.
Yeah. Yeah. But you're doing it. You're doing
Yeah.
it. So
Yeah,
it's really
absolutely.
exciting. So how do you see this kind of shaping your practice? Like, it sounds like just from, the emails we've been exchanging lately, you really do see this as being kind of a central offering.
I
Um,
do.
Tell me more how you kind of envision this going
Yeah.
for your practice.
Oh, I'm envisioning, so I have got a vision and, our tagline for our business is "Because there's more to life."
I love that.
And, I'm got this vision of having a clinic. So we have a group practice here that
Hmm.
I envision filling our clinic, our practice up with more clinicians that are interested in and that are implementing
Hmm.
ketamine assisted EMDR, so that we can really help to serve the people that are in our area. And like I said, when we started, I kind of feel we've got a bit of a wraparound approach. So we have some
Hmm.
people that come in that need those basic skills. They're not
Yeah.
ready to go into
Right.
that deeper processing. So let's do some skills training. Let's get regulated. Let's talk about grounding. Lots
Yep.
of really good resourcing before
Hmm.
we jump into adding any kind of bilateral stimulation or any kind of medicine in, because we want to
Yeah.
be really intentional and we want to be
Absolutely.
really safe with the work that we do. We're here to help heal,
Hmm.
not to cause any kind of harm. So
Absolutely.
I see us growing in that way. And I've kind of been joking with my husband, like we're starting to actively recruit. We need to hire.
Uh-huh.
I am getting referrals. I have a wait list and I need somebody to help me. So I'm like, okay, first of all, I thought I need to clone myself. And I'm like, I can't clone myself.
I feel the
Like,
same.
yeah, I need to hire. And then I'm like,
Yeah.
okay, I need to hire, but who am I going to hire? And I'm like, I need a unicorn. And then I'm like, where am I going to find a unicorn? And then I'm like, a unicorn farm. And I'm like, where's the unicorn farm? And then it's like, oh, maybe we will be the unicorn farm.
Mm,
So I've
mhm,
got like this vision of
mhm.
let's grow this in our
Yeah,
area. If I've got the vision to expand this and grow this, and I see how helpful it is and how
uh-huh,
people are being transformed, then
uh-huh.
come on in and let's
Yeah,
grow together. I would love to work with people that want to learn this modality so that we can work together to do
yeah,
more of this in our area.
that's really exciting. Yeah.
Yeah.
So I know we don't have a ton of time, but I'm curious if you want to share about any particular experiences that maybe you've seen,
Yeah.
without giving away too much
Oh,
information, but I wonder if there's any specific examples of
yes.
cases or, just things you've seen in your practice as a result of
Yes.
using the KA-EMDR that you might want to share.
Yeah. There's a particular client, and I asked for her permission in order
Mm,
to share a little bit of her story. And she's like,
mhm.
yes, please.
Okay.
Um, so she came to me over a year ago. I think it was in April of 2025. She was a referral from another therapist
Mhm,
to work on her presenting concern was related to sexual abuse when she was a child.
mhm.
And it had been something that she and her therapist at that time just hadn't been able to get past, like the stuck point.
Yeah.
So she came in and started to see me, and we would joke around, developing rapport and all of those things are so important, developing a relationship.
Mm-hmm.
And she
Mm-hmm.
knew that she really wanted to work on this. And every time we would get close to touching it, it was
Yeah.
just so sore
Yeah.
that we would joke that she would call herself a flight risk. So she'd be looking at the door and looking at the clock and get fidgety and like, okay, I think I'm ready. Is it time to go yet?
Yeah.
And we would just kind of laugh and joke about that, and that was fine. But really, very much pacing. And we did
Mm-hmm.
some EMDR without, this is before I was trained with using
Mm-hmm.
ketamine. We've done some EMDR. We've done some accelerated resolution therapy. So
Mm-hmm.
different things to work to calm her nervous system and do the work.
Mm-hmm.
And she was getting very frustrated with, I'm doing the work, I'm doing the work, I'm doing the work, and I'm still feeling stuck.
Mm.
And this was and so further into this, then I got trained in ketamine assisted EMDR. And when I learned about it, I started talking to her about, I've learned about this and I'm going to do
Yeah.
this training. And she kind of laughs and it says, of course you're going to do a training.
Something else. Okay, let's do it.
Something else. Yeah. I'm going to do this training and I don't know much about it yet, but I think that it could be something that might be good. And
Mm-hmm.
then after I got trained, then we talked more about it. And at first, she was a little like, seriously, I'm working so hard. And now I need to add medicine in order to get to this. So there was a little frustration, but then
Yeah.
there was also and this is important to me. I want to work through it.
Okay.
So we
Yeah.
started in February of this year with doing ketamine assisted EMDR. I think it's very important when we're talking about people that have complex trauma that
Mm-hmm.
it's really important to pace this.
Absolutely.
So
Yeah.
we're not coming in and doing one ketamine assisted EMDR session after another, after another,
Mm.
after another, but we intentionally paced it so that they were about a month apart.
Okay.
And we started
Mm-hmm.
working on her presenting concern. And then all of the other things that came up as a result of presenting concern when we started implementing the medicine.
Mm-hmm.
Now, when we implemented the medicine, she was able to, it truly did increase her window of tolerance so
Mm-hmm.
that she could stay in the chair without trying to flee out the door. That doesn't mean it was easy. It
course.
still wasn't easy, but she was invested in doing the work. And we met this week, and it was her fifth ketamine assisted EMDR session this week. And we did a reevaluation. So
Mm-hmm.
we learned in the training that the International Trauma Questionnaire is a really great
Mm-hmm.
assessment that whenever we're
Mm-hmm.
thinking about, all right, this is where I'm going to focus on, then we can
Mm-hmm.
do this assessment to kind of give us a baseline so that we
Mm-hmm.
can look at it in the future to see what's the improvement been.
Mm-hmm.
And her scores for her PTSD scores, when she originally did the assessment, so when we started in February, her total
Mm-hmm.
score for on the International Trauma Questionnaire was 33.
Mm.
And then when we reassessed this week, her total score was 12.
Wow.
So
Wow.
she no longer fits the
Mm-hmm.
criteria for a diagnosis of PTSD or CPTSD. And she was so thankful.
Mm.
And just like she said, Cheryl, I know you told me that this was possible, but I
Yeah.
didn't really believe it. And just for her, the changes that have taken place, the way that it's impacted her relationships, the
Mm-hmm.
way that it's impacted her sense of identity and self, her
Mm-hmm.
ability to advocate and to just feel strong in who she is. She walked out of my office with an empowerment and a feeling of, okay, I know that there's more.
Mm.
And she's a person of faith, and she's like, all right, God, I don't know where you're leading me next, but here I am.
Wow.
And it was so powerful, just powerful. And that's an opportunity for she and I to even connect. And I mean, I cried with her.
Oh yeah.
Just seeing just seeing this
Oh yeah.
transformation and what this has been for her.
Mm.
Really powerful.
Wow. You're
Yeah.
taking me back to our research study days, when we were looking at the changes in not only the score, but just the
Yeah.
actual quality of life for people,
Yeah.
I mean,
Yeah.
that is
Yeah.
amazing to hear.
She said, I
That's
used to
really
hate these
amazing.
questionnaires. She's like, I hate these assessments. I hate
I
these
bet.
questionnaires.
Yeah.
I hated it when you did this.
They're
And she said, now I
painful.
like it. Yeah. She's like, I
Yeah.
like this is great. So yeah.
That is incredible. And I
Yeah.
really appreciate her giving you permission to share that here
Me
because,
too.
I mean, this is what we want people to know, right? That
Yeah.
those types of transformations are possible.
Yeah.
Now, of course, you had done so much wonderful work prior to ever
Oh yeah.
implementing KA-EMDR, and I'm sure
Yeah.
all of that mattered a lot, right?
Mm-hmm.
But
Mm-hmm.
what I think I'm hearing and what Michelle and I have seen, we saw this in our research study, we see it in our practices, is the addition of KA-EMDR just really seems to help people when they're ready for it,
Mm-hmm.
move through material
Mm-hmm.
in a way that they just could not do
Yeah.
before,
Yeah.
despite what I'm sure you did so many different things to try
And
to help her.
she was so invested in all of it.
Yeah,
I
it
mean, she
sounds like
kept
it.
coming
Highly
back and
motivated
coming back. Yeah, very
and good
motivated.
relationship and all, all
Yes.
that.
Yes.
So, wow.
Yeah.
I'm so happy for her and for you. That's
Yeah.
beautiful.
Yeah.
That's really great.
I just can't say enough about, I mean, I'm just so honored to have been with her through that process, to
Yeah,
experience that with her. And as a clinician, that's really encouraging too. The work that
absolutely.
we do is hard work.
Very.
And when we have a story like this, it can be
Mhm.
really motivating and encouraging for us to say, okay, yes, it's hard work and it's worth
Yeah,
it. Yeah.
exactly. Yeah,
And I'm
because
so proud of her for pushing through. Even when
yeah,
it was hard, even though it
yeah.
was hard, she still pushed through.
Mm, yeah. And it takes a certain type of person, I should say, who is willing to do this, right? Michelle and I
Yeah.
always say this won't be for everybody, or at
Mm-mm.
least not at this point in their life, right? They might need to
Mhm.
try some other things first, but I think it does take a certain person who is motivated and willing to kind of like go there and try something new and kind of
Yeah.
trust
Yeah.
I mean, it takes putting a lot of trust into the
Yeah.
therapist and into the process,
Yeah.
but it sounds like
Yeah.
she did that and man,
She
the
did.
payoff was pretty great,
It
so
was. Yes, it
thank you for sharing
was.
that and
Oh,
thank you to your client
yeah.
for being open to that.
Yeah.
So
Yeah.
that's wonderful. I'm so excited
Yes.
for you, Cheryl.
Thank you.
I know when we first met in the experiential training, I could tell you were going to do great work with this. And then, in consultation, I could tell you were going to be one of the ones that kind of took it and ran with it. And
Mm.
not everybody does, right? But
Right.
you are one of the ones that said, okay, I'm going to do something with this and actually implement it and get to see what's possible. So I'm really excited for you.
Thank you.
And I'm
Yeah.
excited
Well,
to see more of what comes in the future.
me too. Me too. I mean, it works. No,
Yeah.
when everything comes together, it does have to be, you have to have, I mean, the
Yeah.
client needs to be motivated to want to do this. And then
Mhm.
there's a lot of creativity that comes with the therapist too, that you've got to use a lot
Yeah,
of creativity and a lot of
definitely.
presence and that's
Absolutely.
exciting
Yeah.
too. But yeah, yeah. So it's not easy. I wouldn't want anyone to
Mm-mm.
think that this is easy work for the therapist or the client, but it
Yep.
is worth it. It's
Mhm.
also not a magic wand because I
Yep.
do get some people that come and they're like, "Oh, I think that this would work," and wave the magic wand
Yeah.
and it'll be all better. And there's
Yeah.
no such thing as a magic wand. It
No,
is
there's not.
hard work. Yeah.
Yeah.
But there is
Yep.
hope.
Absolutely. Yeah.
Yeah.
I'm so excited to continue the journey with you, as you work towards your consultant credential, which I'm really excited to
Yes.
do together with
Yes.
you and
Yes.
see where your practice goes and hear more stories about these wonderful transformations. So
Yes.
people are
Thank you.
clearly in very good hands with you. So I'm happy to know you are doing this.
Yeah.
Where can people find more information about your practice if they are looking for a therapist? Maybe people in your area who might be interested in joining your practice if you're hiring.
Yeah.
Where can
Yeah.
people find more information or how can they reach you?
Yeah, right. Yes, we are hiring. And you can find me. My website is www.moorelife, moorelifecc.com. And you'll
Great.
find me on there and then a list of the therapists that share space with us as well. You can
Great.
email me. I'm Cheryl with a C at moorelifecc.com.
Great.
And yeah, reach out one of those two ways. I'd love to have a conversation. Put you on my wait list if I'm not able to get you in right away, or to refer you to someone that's qualified here in our area too.
Awesome.
Yeah.
Okay, Cheryl. Well, thank you for joining me. This was lovely. Maybe we'll have to
Yes.
have you back a little later, to see how
Yeah.
things are progressing. But thank you for making
Sounds
the
great.
time to join me.
Yes. Thank you for having me. Thank you for the invitation. I really appreciate it. And thank you so much to you and Michelle for
Um,
the work that you have put into developing this methodology and the continuing education and the consultation and all of the stuff. I know it has not been easy, and I
no.
am so grateful. And my clients
Um,
are so grateful. And this will continue to resound through
yeah,
many, many, many people for a long, long time to come.
I really
Thank
hope
you.
so. Thank you for saying
Yes.
that because that is our hope. That is our
Yes.
mission, right? Is to once we saw what we were doing with our clients, we were like, we have to share this.
Yeah.
We have to share this.
Yeah.
And that's our mission, right? Is for it to touch
Yeah.
as many lives as possible in a positive way. So thank you, Cheryl.
Right.
So
You're
sweet.
welcome. Yes, you're welcome.
Okay. Well, we will keep in touch.
Okay.
All
Sounds
right,
great.
Cheryl.
All right.
Okay.
Thank you,
I'll talk
Danielle.
with you soon.
All
Bye.
righty. Bye-bye.
Thanks for listening to Loosening Up, the KA-EMDR podcast. If you'd like to learn more, visit www.ketamineassistedemdr.com, where you can find out more about our research, our training programs, and you can also find a KA-EMDR therapist to work with.